we are going to study rectus sheath. Rectus sheath is the aponeurotic sheath. It is like a long fibrous envelope that covers the rectus abdominis muscle and pyramidalis muscle if present. Here we can draw the muscle, for example, rectus abdominis, and rectus sheath is made up of external oblique, internal oblique, transversus abdominis. Now here we are drawing the further components of the rectus sheath: costal margin, diaphragmatic fascia, transversalis fascia. This is the rectus sheath, rectus abdominis muscle, and rectus sheath is bound to the rectus abdominis muscle by the tendinous intersections. Now, rectus sheath is considered at 3 levels. Level number 1, above the costal margins. Like here we can see this is the boundary we draw above the costal margins. Between the costal margins and the arcuate line, and below the arcuate line, or we can say between the arcuate line and the pubis. Now what is arcuate line? Arcuate line at the level of anterior superior iliac spine. Okay, the posterior lamina of internal oblique ends up in a free curved margin. This forms the arcuate line. Now 3 levels of the rectus sheath. Number 1, above the costal margin. Anteriorly, the rectus sheath is made up of, here we can draw this like rectus abdominis muscle, and then this aponeurosis of external oblique, and posteriorly only by the costal cartilages. Between costal margin and the arcuate line, now we have to remember this. Okay, like this you can draw lamina of internal oblique. Now internal oblique is divided into 2 slips. One slip anteriorly and one slip posteriorly forms the rectus sheath. Then posteriorly rectus abdominis muscle, anteriorly external oblique muscle, and posteriorly obviously transversalis fascia. Between arcuate line and pubis, transversus abdominis muscle, internal oblique aponeurosis, and external oblique aponeurosis, and posteriorly only relying on the transversalis fascia, no rectus sheath. We have to study its features. Anterior wall complete, obviously we studied it, that it is complete at all the 3 levels. The posterior wall, it is incomplete, not present above the level of costal margin and below the arcuate line. It is only present between the costal margin and the arcuate line. Now medial wall, this is the linea alba. I have told in my previous videos, linea alba is the imaginary straight line between the xiphoid process to the pubic symphysis, and around the linea alba, to the lateral to the linea alba, the linea semilunaris. Now what is linea alba? Linea alba is basically fusion of all the aponeurosis of the muscles in midline of the abdomen. It is wider above the umbilicus and narrows down below the umbilicus. Now lateral wall, linea semilunaris, lateral to the linea alba. Contents of rectus sheath: nerve, lower 6 thoracic nerves, L1, that is ilioinguinal and iliohypogastric, the pyramidalis muscle. Arteries: superior epigastric artery, inferior epigastric artery. Now we are drawing all the 3 levels of the rectus sheath, and here this is the inferior epigastric artery and this is superior epigastric artery. Inferior epigastric artery pierces the rectus sheath at the level of the arcuate line, moves upward to anastomose with the superior epigastric artery. And veins: superior epigastric vein, inferior epigastric vein. Now muscles: rectus abdominis muscle, pyramidalis muscle, Pyramidalis muscles lies in the lower part of the rectus abdominis muscle. Functions of the rectus sheath. It checks bowing of the rectus abdominis muscle while contracting, i.e. it supports the rectus abdominis muscle, increases efficiency of muscle, strengthens the abdominal wall. Oblique muscles laterally flex and rotate the trunk. Rectus abdominal flexes the trunk, stabilizes the pelvis and muscles of the anterior and lateral abdominal wall. They assist the diaphragm during inspiration by relaxing as diaphragm descends and abdominal contents can be accommodated. Muscles assist in forced expiration as well. We can say forced expiration occurs during coughing or during sneezing, and by contracting simultaneously with the diaphragm, these muscles help in the forced expiration. The glottis of the larynx closed, the increased intra-abdominal pressure, and helps in micturition, defecation, vomiting and parturition as well. Muscles don't play an important role in supporting and protecting the abdominal contents. Clinicals of the rectus sheath hematoma. It is uncommon but important. It often occurs below the level of umbilicus. Source of bleeding is most commonly inferior epigastric vein, not artery. Artery is the rare source of bleeding. Cause of the hematoma. Any blow or injury or blunt trauma to the anterior abdominal wall may cause this hematoma. The vessels may be stretched during severe bout of coughing or during later stages of pregnancy, and this also may cause hematoma. Symptoms of the rectus sheath hematoma: midline abdominal pain, and it could also be the acutely tender mass confined to the rectus sheath. We can touch and feel it.